From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and we are so excited to have Dr. Josiah Fitzsimmons joining us in studio once again from Peripheral Neuropathy, along with Alex Cruz-Koenig and a special friend that we are going to meet here in just a couple seconds from the Animal Rescue League of Iowa, as Dr. J is becoming friends with Charlie here. But Dr. J, first we want to talk about neuropathy pain and how many people suffer from neuropathy pain and what viral neuropathy can do for it. Now, we understand over 3 million people a year suffer from peripheral neuropathy. That's a lot of people.
It is. It affects way more people than people realize.
Yes, and according to Johns Hopkins University, there's more than 100 different types of neuropathy. What are some of them?
Absolutely. I know that sounds daunting with so many different types of peripheral neuropathy, and there's so many different ways neuropathy can be caused. But one of the most common causes of peripheral neuropathy is diabetes, and that's where a lot of people have diabetic neuropathy. When you have consistently high levels of blood sugar for sustained periods of time, that can start to damage the outer protective coating of the nerves, and that's when people start to get all the numbness, tingling, burning sensations with neuropathy, especially associated with diabetes.
Is that because those impulses are just jumping around all over the place?
Great question. Yeah, so you should have this nice protective coating around your nerves, just like the outer rubber coating on an electrical wire for your cell phone charger, for example. And when you have the high level of blood sugar, it causes high levels of inflammation, which then deteriorate that outer coating around your nerve.
All right. Now, what other types of neuropathy do you see most often by you?
Yeah, absolutely. So idiopathic neuropathy is a really common type of neuropathy where people just unknown cause, also high cholesterol levels, statin drugs, exposure to different toxins. But the classifications, what they call them, is motor nerves, sensory nerves, and then autonomic nerves is how the body gets affected. So your motor nerves are your muscles, your movements. So people's movements can start to get affected, maybe their balance ability. Also sensory nerves, this just ability to feel, touch. You know, we've had people that haven't felt their feet in decades before they come into our office. And then there's your autonomic nerves, which is the nerves that control things that you don't think about, like breathing, your heartbeats. You know, obviously, you definitely don't want those nerves to get affected, because those can control very, very vital organs and functions of your body. And so neuropathy is a progressive degenerative condition. So typically nerves start getting affected. You don't even know they're affected until it gets to a stage that can become very debilitating.
Now, most important question is, can this be reversed?
Yes.
Yes, that's the bottom line. Yes.
Absolutely. That's the big thing we tell everybody, because so many people have tried so many different things to just mask their symptoms with neuropathy. They've been told for decades by doctors there's nothing you can do except cover up the symptoms, take these drugs, gabapentin, Lyrica, Cymbalta. But that's not the case anymore. With advanced technology that we have and we utilize in our office, we can absolutely reverse neuropathy. But you got to get in sooner rather than later. Once you get up over 80% nerve damage, that's typically when it becomes irreversible. And so you got to get in sooner rather than later, because it's a progressive degenerative condition, like I talked about. It's just going to get worse and worse and worse. It's not a matter of if you should do something, it's how fast can you do something to have the best overall outcome and the best quality of life. Yeah, you need to do something about it. You have one of your patients that had a chance to say something. Yeah, absolutely. Yeah, we have one of our great patients, Dennis. He actually hadn't felt his feet in over 20 years before he first came to our office. He started feeling them only 6 weeks into care after not feeling them and having neuropathy for over 30 years total. All right, let's hear from Dennis.
Immediately, I started feeling the difference in a week. I come 3 days a week first, and I do my therapy every day, light therapy and the water therapy. And boy, I could just tell the difference every week. It's just really impressed me. And it's such a feeling to feel your feet again after you can't feel them for so long. I mean, feel warm and cold, you know. It's great. And it's affected me all over my body.
Yeah, how about that? You want to get results like that, you have a special going on right now. I want people to take advantage of that.
Absolutely. Come into our office. We actually do 8 different unique tests to diagnose the exact percentage of sensory loss that people have in their hands or their feet. We'll calculate down the exact percentage of loss that someone has. And so typically, when you get neuropathy exams, they just take a sharp stick, poke you a few times on the bottom of your feet. We go very in-depth, figure out exactly what's going on, what your goals are, lay out an exact individualized treatment plan for everybody that comes in our office. That way we can have amazing testimonial like Dennis.
There you go. 335-VERO is the number to call. 515-335-VERO, and get checked out today and start having results. Now, we need to get some results by getting a dog adopted here, Dr.
That's
J.
right. We got to get Charlie adopted.
Yeah. Alex Cruz Koenig is here joining us with Charlie. Tell us about Charlie really quick.
Yeah, Charlie is in shelter with us right now. Charlie is 8 years old. He is a bloodhound mix. He is a fun-loving, free-spirited guy. He has no complaints. He just loves life, and he'd be a great companion for anyone who just wants to hang out and have a good time
Now,
every
is he
day.
at the main location of the ARL?
Yes, he's at ARL Maine hanging out with us.
Yep.
And he is looking for his forever home.
All right, now people want to get more information. You can see on the screen where you can go. Charlie available for adoption, arl-iowa.org.
There he
and
is.
make an appointment to see him. And bring treats like Dr.
Yes.
Josiah Fitzsimmons is, and you become his instant pal for life. That is so cool. Thank you so much for bringing Charlie over.
Of course.
We'll see if we can get Charlie a new home. And Dr. J, one more time, the number to call for people to get information and get checked out over at your place for $49. Normally $249 is what?
335-VERO, that's 8376, so 515-335-8376. Yeah, give us a call as soon as possible. Get on our schedule. We do get really, really busy this time of year with the Iowa State Fair. Everyone coming in from all over the state to our clinic, so better get in sooner rather than later. Get on top of this condition so you can really enjoy your life, enjoy the rest of summer.
Awesome. Dr. Josiah Fitzsimmons from Peripheral Neuropathy, thank you so much. Alex and Charlie, thank you for being here.
Oh, yes. Great morning.
All right, we'll be right back. This is Iowa Live.